This is CGTN, China Global Television Network.
Tremors felt across the Caribbean after a magnitude 7.2 earthquake strikes Haiti. U.S. Special Envoy expected in Ethiopia as conflict in Tigray escalates. And the Taliban closing in on the Afghan capital Kabul as refugees flee into neighboring countries. Hello and welcome to Africa Live. As always, great to have you with us. I'm Richard Nta, live in Nairobi. And for those of you joining us from across the continent and around the globe, we thank you for joining us. Let's begin in Haiti now, where a magnitude 7.2 earthquake has struck western Haiti with tremors felt across the Caribbean. Authorities speaking to AFP say at least 29 people have died so far. Residents near the epicenter of St. Louis du Sud have uploaded videos showing damage. The quake's epicenter was about 125 kilometers west of the capital Port-au-Prince, according to U.S. geological surveys. And the USGS also issued a tsunami warning with a possibility of waves up to 3 meters. The country is still recovering from a magnitude 7 earthquake closer to the capital 11 years ago that killed tens of thousands. The U.S. has joined calls for an end to fighting in Ethiopia's Tigray region. President Joe Biden is sending the U.S. Horn of Africa Special Envoy to Ethiopia. Jeffrey Feltman will be charged with helping efforts to stop the fighting. Prime Minister Abiy Ahmed has yet to release an official statement regarding the visit. Feltman will also visit Djibouti and the UAE over a 10-day trip. Earlier, we spoke to CGTN's Guru Mchala for the latest.
And the Special Envoy for President Biden is expected here in Addis Ababa, perhaps in the beginning of the week, and he is mandated by the president to try and find a way of concluding the Ethiopian conflict in the north peacefully. He's been here once before to try the same mission, but by that time he made the prime minister, he made the foreign minister, and other stakeholders, and he went back and suggested that the Ethiopian conflict should be concluded peacefully, and his efforts by then were not successful. Now his return is highly expected as well, as the U.S. is an important ally to Ethiopia. The Ethiopian government also values his mission to Addis Ababa and wants to cooperate with him. According to the information we have, Feltman, by the way, is an experienced diplomat in the Eastern Africa region, in the Horn of Africa region in general terms. So in his mission, we have also heard that he will be in Djibouti, and he will be also visiting the United Arab Emirates, also Addis Ababa here. So he is highly expected here in Ethiopia, so that Ethiopian authorities can also share their thoughts about the ongoing conflict in the north.
Let's turn our attention to Afghanistan, where the Taliban continue to close in on the capital Kabul. They've just captured Asadabad, the capital of the eastern province of Kunar. They have taken more than half of the country's provincial capitals in just over a week and now control at least 2/3 of the country. The Taliban say they are now close to capturing the town of Maidan Shar, just 30 kilometers to the southwest of Kabul. The United States and Britain have deployed an extra 4,000 troops to oversee emergency evacuations. President Ghani said his government is in talks with local leaders and international partners.
In the current situation, the reintegration of the security and defense forces is our priority, and serious measures are being taken in this regard.
Let's now turn to the extreme weather being experienced in parts of the world now. In Turkey, rescue efforts continue in the Black Sea region after seeing its worst floods in years. At least 44 people have been killed, with fears that the death toll could rise. This is the second natural disaster to strike Turkey this month. The floods brought destruction to northern provinces, just as a wildfire in the south was brought under control after it raged for 2 weeks. Turning to the pandemic now, the UK has deployed experts to Tunisia to help in the response against COVID-19. The medical experts specialize in emergency medicine and infection prevention and control, as well as humanitarian health care. The Tunisian authorities say the health situation is improving, but it remains critical.
The Tunisian Health Ministry announced that the UK medical team will provide clinical supervision and support to local healthcare services. The UK experts will work with Tunisian medics and paramedics to fight against the pandemic.
Sending foreign medical teams is an important contribution to Tunisia's effort against the pandemic. Tunisia faced a crisis at the end of July because beds were available at field hospitals, but we did not have the necessary medical staff. Our doctors, especially those specialized in resuscitation, are leaving the country because they're in high demand abroad. The UK or any foreign help is welcome.
Dr. Jalila bin Khalil added that the COVID-19 positivity rate has dropped to 22.49%. The expert noted that Tunisia's healthcare system is no longer buckling. However, the situation is still alarming throughout the country.
According to the latest data on the situation of the pandemic, published by the National Observatory for New and Emerging Diseases, there are positive indicators because infections are declining. The number of positive cases out of all daily cases has dropped from more than 50% in the last 2 weeks of July to some 22% this week. This is a positive sign.
Following President Zayed's diplomatic efforts, more than 6 million doses of COVID-19 vaccines were donated from friendly countries and delivered to Tunisia. The North African state has stepped up the vaccination campaign to curb the rate of infections.
The only way to reduce infections and ease pressure on health facilities is to get vaccinated. I'm aware that getting inoculated does not mean that I'll not get infected, but at least my body will be ready to fight the virus and avoid the emergency unit. The medical and paramedical staff are doing a great job.
The health department revealed that the number of infections and hospitalized patients has decreased in recent days. There were more than 5,000 people in ICU and oxygen beds during the peak of the third wave of the pandemic, while there are more than 3,000 hospitalized people this week. According to the Tunisian COVID-19 task force, the UK medical team will support counter-COVID-19 efforts in field hospitals. Many countries will also send medical teams and equipment to Tunisia in the next few days. Adnan Shawishi, CGTN, Tunis.
The Nigerian government says its military will play a key role in getting COVID-19 vaccines to areas hit by insecurity, especially in the northeast. The region has been plagued by an insurgency by Boko Haram militants that has made the movement of vaccines and health personnel difficult. CGTN's Kalechi Mekalam reports.
Nigeria has seen an improvement in vaccine shipments to the country. The West African nation has just received 4.8 million doses of the Moderna vaccine from the US. Another 29 million doses of the Johnson & Johnson jabs purchased by the government are expected to arrive in the country soon. Most areas in Nigeria's northeastern region have, however, been cut off from the inoculation program. But plans are underway to begin rolling out vaccines to the conflict zones.
Working with the Nigerian military, we're going to be focusing on those areas where there is insecurity, and the military will be able to support the vaccination. As you're aware, even within the military, there are health workers. So those health workers will be trained to actually take part in vaccinations in the insecure areas. And then for those places where we have internally displaced people, we will have our health workers actually prioritize those areas.
Nigeria's COVID-19 vaccination campaign began in March 2021 after receiving 3.9 million doses of the Oxford AstraZeneca vaccine through the COVAX initiative. But inoculations have slowed down due to vaccine shortages and hesitancy. However, authorities say they're working hard to ensure vaccinations increase in the country.
I'm sorry to say, but the response has been a bit disappointing, in my opinion, from my own observation. One would have thought, having heard how the COVID-19 virus ravaged several countries, now had the vaccines available in Nigeria, and people were still hesitant about whether or not we should take the vaccines. There's so many negative vibes coming from several sources. Now it looks like, well, some awareness is increasing because over the past few days, I've seen a couple of people coming to ask, where can I get vaccinated? People that didn't want to initially.
We are currently wrapping up the training of about 40,739 health workers all across the national, state, and world levels on our phase 2 strategic vaccine rollout plan, with focus will be on how to improve delivery, communication, management of our vaccines, and the logistics that goes together with this management.
Nigeria has so far received over 8 million vaccines. That would cover about 4% of the country's 200 million strong population when all are administered. The rollout of the second phase of inoculations is scheduled to begin next week, and authorities are confident that more people will turn up to get vaccinated after overcoming their initial fears. Kelechi Emekalam, CGTN Abuja, Nigeria.
You're watching Africa Live. A lot more coming your way after the break. Here's a peek at the headlines. Coming up, award-winning app connecting farmers to supermarket chains in South Africa.
How will your world change today? What happens here? What happens there? Or what you make happen for yourself? If it matters to you, it matters to us too. Your stories are the stories that need to be told. Africa Live. Find your voice.
Welcome back to Africa Live. Thanks for sticking with us. Hundreds of displaced people in Somalia's Shuter district northwest of the capital Mogadishu are in dire need of humanitarian assistance. The Al-Shabaab terror group has controlled Shuter and neighboring towns in Bakul region for the last 7 years, cutting off road access for aid to vulnerable populations. CGTN Daniel Arab Boy reports.
This is Madakswara, the internally displaced people's settlement in Hudur district. Many displaced families who depend on humanitarian assistance have been left helpless. Displaced 80-year-old mother of 5, Fatuma Nisho, does not know where her next meal will come from.
We have not cooked for the last 4 days because we have no food to eat. We are starving. We badly need to be supported.
Fatuma's situation is compounded by an aid blockade by the Al-Shabaab militant group. Climate-related shocks have also worsened the humanitarian situation in the country.
Gaps still exist and people are still coming because of they're being displaced by conflict and they're being displaced by drought.
The 2021 humanitarian response plan for Somalia seeks $1.1 billion to provide life-saving assistance. But only $432 million of the required funding is available, the lowest in 6 years. A delegation on a humanitarian assessment mission visited Hudur to establish the situation on the ground. Somalia has one of the highest numbers of displaced people in the world. Some 2.9 million people, nearly 25% of the population, are displaced. Daniel Arab Moi, CGTN, Nairobi, Kenya.
An agri-tech startup called Kula App is harvesting benefits for farming communities in South Africa. Kula is a supply chain solution for emerging farmers. The award-winning app helps emerging farmers connect with supermarkets by making it easier for them to market, sell, and transport their produce. CGTN's Yulisa and Jamela has more.
Millions of small-scale and emerging farmers here in South Africa face a number of hurdles. These farmers have it rough as they have to deal with issues ranging from marketing and selling to transportation of their goods and produce. Enter Kula App, created by young entrepreneurs Caridas Chintolo and Matthew Piper. Kula essentially connects farmers in emerging markets with the formal marketplace. Using the app, farmers are able to list their produce and track real-time inventory levels from emerging farmers as well as basic production forecasting.
The key benefits and the key pain points are more on the small scale side. The key pain points are more on the emerging side. These are the guys who've been excluded. These are the guys who haven't been as included as much. And the uptake there has been much higher because now we're giving them the same access that the commercial guy has had access to for years and years.
The app also includes a crowdsourcing marketplace where farmers can satisfy market demand and incoming orders.
We're seeing a lot of farmers harnessing the ecosystem that we have built. And this is an ecosystem that's built for the guy who just started today, who just got a piece of land, who doesn't know where I need to go, the person who's been farming for 10 years, and the person who's a third-generation farmer.
Kula has already received a number of awards for innovation and practicality of the app.
So the work that we've been doing has drawn a lot of attention because it is important work, and it is the kind of work that if we get it right, it will really change the narrative around agriculture. It will speak to food, it will speak to employment, and that work has attracted a number of accolades. We've been recognized by MTN as the #1 app in South Africa, as the #1 app also in the industry in South Africa. Google has recognized us this year as one of the top 15 early stage startups on the continent, and also the Shivers Global Venture Competition recognized us as one of the top 10 social enterprises in the entire world.
Hundreds of farmers use the app.
The interest has been very good. One of the big misconceptions is that farmers are not digitally sound or they're not prone to technology. I think it's a big myth. Farmers have been very receptive and they've adopted the solution that we have brought onto the table. So the number is increasing.
The co-founders want to expand to other parts of the continent. They also want to introduce the app to other emerging markets such as India and Brazil. Yolisa Njamela for CGTN in Johannesburg, South Africa.
The Masai Mara is by far Kenya's most popular game park and is widely considered one of the greatest game parks on earth. Its main attraction each year has been the great wildebeest migration. CGTN's Robert Nagila takes us along his experience at the Mara. Let's take a close look.
Hello? Are you ready? Come on my way. It is said a visit to the Masai Mara is an unforgettable experience. That's what we want to find out. Now, this is Robert Kingori. Robert, say hi to the viewers. Hi. Now, show me the best of the Mara. Wait. Zebras. Less than 100 meters outside our tented camp, and already zebras all around us. Brilliant, absolutely brilliant. Look, wildebeest. So these will likely be crossing the Mara River over to Tanzania in the next few weeks.
Now, let me go and show you the big five.
Okay, forward.
Look, it's a small herd of elephants. Such amazing creatures. Beautiful.
Hardly an hour's gone past. We've already seen wildebeest, zebras, elephants.
Here are the giraffes.
It does look like the National Reserve is on fire, but that is a controlled fire. Side to center? All right. Whoa. So that was quite the game drive. Missed out on buffaloes and rhinos, but as they say here, tomorrow's another day. Robert Nagila, CGTN, Masai Mara, Kenya.
We're not done just yet. We've got your sports news coming up. Here's what's ahead. The Futsal Nations Cup in Nigeria turned deadly after players contract malaria.
How would you create your legend? On the fields, on the tracks, in the arenas of Africa. Were you born to be a player? Could this moment be yours? Sports Scene. Find your game.
Africa Live. Find your voice.
Welcome into Sport on Africa Live. The Egyptian futsal national team players are still recovering from a deadly outbreak of malaria after returning from the Africa Futsal Cup of Nations held in July in Nigeria. 19 players from the final match between Libya and Egypt fell sick and another passed away. CGTN's Adel Al-Mahroui reports.
Libyan Prime Minister Abdelhamid Dbeibeh makes a hospital visit to the futsal national team in Turkey. 16 players got infected with malaria last month, and due to the lack of healthcare in Libya, the sickened athletes have been sent to Italy, Turkey, Tunisia, and Egypt for treatment.
The Libyan Federation doesn't have resources as our funds are limited from the sports ministry. Honestly, there isn't any significant support from the ministry. It only supported us after the infection of the players became a matter of public interest, so it was quite late. We thank God that countries like Egypt, Italy welcomed us to treat our national team.
The malaria futsal outbreak started to get public attention in Libya after 24-year-old athlete Ayman al-Nagrish died from the parasite in Tunisia. 5 players remain in critical condition. Libya's prime minister ordered an immediate investigation into this medical crisis. Accordingly, the president of the Libyan Federation got arrested.
Before we traveled, our federation president called the head of the infection department in the health ministry. He told us not to worry and there are no major health concerns in Nigeria. Therefore, we didn't get any vaccination or medication. No one at the border control who knew we were heading and coming back from Nigeria asked for any medical report. So we are holding the health ministry responsible. They didn't provide us with any medical team.
The infection reached the Egyptian team as well. At least 3 futsal players got malaria. Last week, Saddam Al-Hassan, a player in the Egyptian national team, died. Neither the sports ministry nor the Futsal Federation have announced the cause of his death.
The Egyptian Federation officials tried to somewhat silence the news about these infections. Officials, though, are investigating the matter and are looking into how the Futsal Federation is handling the issue. It's not the first time this has happened. 2 years ago, a Zamalek official got malaria and died after the club's match with TP Mazembe. The club paid financial compensation to his family, and I believe it will be the same in this case.
Egypt says all its players got malaria vaccination before they traveled to Nigeria, where the second Futsal Africa Cup was held. 9 nations were competing this year in the Futsal World Cup qualifying competition. The final saw Egypt win 1-0 against Libya. Malaria is not contagious. The only way a person gets infected is through a certain kind of mosquito bite or through blood transfusion. The bug is not in Egypt or Libya, which means the futsal infections could have spread beyond these 2 national teams in Nigeria. Mini football is an independent sports association. FIFA or CAF do not enjoy any authority over it, which means that unless investigations are led by the sports governing body or the countries that reported malaria, the players who got infected or the families of those who died cannot ask for any rights. Adel Mahroui, CGTN, Cairo.
And to the English Premier League we go. Bruno Fernandes scored a hat-trick as Manchester United thrashed Leeds 5-1 Saturday in the English Premier League. Paul Pogba set up Fernandes for United's 30th minute opener before Luke Ayling equalized after the restart. Mason Greenwood regained the lead for Ole Gunnar Solskjaer's side. Fernandes netted his second in the 54th minute before completing his first hat trick 6 minutes later. Fred swept home the 5th goal in the 68th as United made a statement about its Premier League title credentials. Elsewhere, European champions Chelsea stormed to a 3-0 opening day win over Patrick Vieira's Crystal Palace. The Blues got their opening goal through a Marcos Alonso superb free kick just before the half hour. Christian Pulisic netted Chelsea's second before debutant Trevor Chalobah drilled a 25-yard strike for the third goal as Chelsea claimed the 3 points. And France center back Raphael Varane has finalized his move to Manchester United on Saturday for a reported fee of about $56 million after signing a 4-year contract. The 28-year-old defender joins from Real Madrid, where he spent 10 seasons and helped the club win 18 trophies, including 4 Champions League titles. He also was a key member of the France team that won the 2018 World Cup. He joined Real Madrid in 2011 from French club Lens. The deal comes almost 2 weeks after United signed Jadon Sancho, with the Premier League club paying Borussia Dortmund a fee of $100 million for the 21-year-old England winger. And to some adrenaline rush now, where Belgium's Thierry Neuville maintained the lead in his home World Rally Championship in Belgium on Saturday. Neuville leads his Hyundai teammate Craig Breen by 6.8 seconds, even after the Irishman claimed 2 stage wins. And the battle for third place between Britain's Elfyn Evans is in third place ahead of Kalle Rovanperä of Finland. Japan's Takamoto Katsuta crashed his Yaris on stage 10, rolling the car. And Sebastian Ogier of France, who is leading the overall standings after 7 of the 11 rallies, is currently in 5th place in Belgium. Tanak of Estonia had to change his wheel in stage 9, costing him over 3 minutes and pushing him down into 6th place. Well, I guess that'll do it for this edition of Africa Live. Remember, you can send us your feedback to the contacts on the screen and follow us on digital media platforms. Don't forget, we've got Talk Africa coming up at the top of the hour in just a minute with Beatrice Marshall, and I'll be with you at the top of the hour with Sports Scene. Don't go away. Keep it right here on CGTN.
This is CGTN, China Global Television Network.
More than half of Africa's population have no access to electricity. That's according to the International Energy Agency. The agency adds that 75% of the world's population without access to power live in parts of sub-Saharan Africa, among them countries like the Democratic Republic of Congo, Nigeria, Niger, and South Sudan. While major strides in power connectivity have been made over the past decade, the deficit is still glaring in Africa, having massive limitations on socio-economic development. So what is the cost of power shortages in Africa? And what solutions are being looked at in bridging Africa's energy gap? I'm Beatrice Marshall. Welcome to Talk Africa.